Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'm going to talk about subcutaneous mycosis. Subcutaneous mycosis. As we know, subcutaneous mycosis can involve derms, subcutaneous tissue, hypoderms, muscles, and fascia. Subcutaneous mycosis usually initiated by piercing of the skin, trauma, or skin abrasion, which allow the causative agent to introduce into the subcutaneous tissue. In fact, this type of mycosis is difficult to treat and sometimes required surgical intervention such as debridement. Debridement in which dead tissue, cutting the dead tissue surrounding the injury. And there are three general types of subcutaneous mycosis: chromoblastomycosis, mycetoma, and sporotrichosis. So the disease of subcutaneous mycosis involves three types: chromoblastomycosis, mycetoma, and sporotrichosis. Firstly, I'm going to talk about mycetoma. Mycetoma, which is a chronic indolent infection of skin and subcutaneous tissue. It is a chronic subcutaneous mycosis. Chronic subcutaneous mycosis sometimes involve bone and lymph node. Mycetoma show three clinical characteristics. In fact, mycetoma show three clinical characteristics: a tumor, sinuses, and grains. A tumor results as a progressive and relatively painless swelling, while sinuses characterized by the disorder. They can be absent in early stage but later develop and drain purulent discharge. Grains represent colonies of the causative agent. When mycetoma infection can be caused by fungi or bacteria. When caused by fungi, it is referred to as mycotic mycetoma or eomycetoma. So when mycetoma caused by fungi, it is referred as mycotic mycetoma or eomycetoma, while when it is caused by bacteria, it is called actinomycetes or actinomycotic mycetoma or actinomycetoma. The lesion of mycetoma, which also known as Madura foot, as we mentioned above, either tumor, sinuses, and grain. Tumor, sinuses, and grain. Tumor, sinuses, and grain. Tumor, sinuses, and grain. Grain are granules, small colony of the causative agent. The mycetoma commonly affect foot, but it can be disseminated to involve leg, thigh, hand, shoulder, and sometimes head. This figure show grains of sinuses. This figure shows sinuses of mycetoma, while the second it is tumor mass from the brain. Mycetoma acquired following skin abrasion or trauma, which facilitate introduce of causative agent into the subcutaneous tissue. Madura foot, referring to the first cause seen in Madura, which a region in India. Infection, as we mentioned, indolent, chronic, sometimes take months to completely established and years to deal with it. It is not contagious, more seen in tropic and subtropic area. Etiology, either fungi, which causes mycotic mycetoma, or actinomycetes, which causes actinomycetoma. So what the causative agent of mycetoma? Mycetoma caused by several mold fungi. The color of grains in this type of mycetoma is black or white, such as Madura mycetomyces, Madura grazia, while in case of actinomycetoma, color of grains yellow, white, or pinkish to red. Actinomycetes are filamentous higher bacteria. The filamentous higher bacteria appear as a long branching. It is sometimes beaded or long roots, and it is mainly gram-positive bacteria. So either mycetoma or actinomycetoma, the causative agent of mycetoma. Actinomycetoma, such as Streptomyces and Nocardia. Nocardia is partially acid-fast state. Nocardia, partially acid-fast state. Nocardia is partially acid-fast state, while Streptomyces and Actinomyces, it is non-acid-fast state. This figure shows mycetoma, Madura foot, mycetoma pedis of the foot. And also this is other figure show Madura foot patient. Diagnosis, fine needle aspiration and cytology, or sometimes tissue biopsy, X-ray and ultrasonography may be employed to in diagnosis of mycetoma or Madura foot. Clinical specimen for diagnosis, bus with grains tissue for histological examination. While in case of actinomycosis, purulent and pseudo-purulent exudate containing grains, which are fungal colony, resemble silver granules. This infection with actinomycosis, lumpy jaw, يعني فك محفر بحفر، يحتوي على large abscess يسمونه lumpy jaw on the head and neck. Silver granule. This is other picture of lumpy jaw. Actinomyces by gram stain. nocardia by a acid-fast stain, which is partially acid-fast stain. Actinomyces stained by Crocot stain, special stain for silver granules of actinomycosis, black precipitate. Crocot stain. This is other picture of Streptomyces by a gram stain. It is a gram positive. Now, how we can laboratory diagnosis of Madura foot. First, you must mention the specimen used in laboratory diagnosis of Madura foot, grains, biopsy tissue, pus, and sometimes blood for serology. You must firstly determine color of grains, because color of grains it's help to identify etiology of causative etiology and initiate treatment of mycetoma. Sometimes hematoxylin, eosine stains, gram stain, Zolnelson stain, and periodic acid shift, 20% of KOH. All this can used in direct diagnosis of mycetoma after you take the grains or tissue biopsy, or sometime in case of aspiration, fine needle aspiration. In case of actinomycetes, homogeneous texture, grains in tissue appear as homogeneous texture, and heterogeneous texture in case of fungi. So in case of actinomycetes, the grain in tissue homogeneous, while in case of heterogeneous texture, that's mean in fungi or eomycotic infection. Also, in case of actinomycetes, grain will not repair filament easily, while fungal grain will contain hyphae and chlamydospore. In addition to that, as we mentioned above, grains will have different morphology and color depending on the causative agent. So the grains, it is helpful in diagnosis of mycetoma, and differentiate, and the shape, texture, and color of grain can used in differentiate of etiology of and differentiate between causative agent of mycetoma. This is a direct microscopy of a specimen from nocardia. In addition to that, this is a direct culture of a specimen. In addition to that, culture of a specimen in Sporotrichosis agar, blood agar medium were used to diagnosis and identification of mycetoma. Also, serology can used in diagnosis of mycetoma by using such as radial or double immune diffusion test. This is mycetoma. The second one, sporotrichosis, is caused by Sporotrichosis dimorphic fungi, which form single-walled spherical, oval, or cigar-shaped spore. And this type of fungi can be cultivated by using subaroid dextrose agar. Some predisposing factor that initiate the infection of sporotrichosis, cutaneous wound, and presence of animal environment. Sporotrichosis may be grouped into three forms: lymphocutaneous, cutaneous, and disseminated. Lymphocutaneous, and cutaneous and disseminated. Lymphocutaneous develop at the site of inoculation, small, firm dermal to subcutaneous nodule. It is particularly developed at the site of infection. Then this infection can disseminate or ascending along with lymphatic vessel and can develop a new nodule. Then lesion, ulcerated and discharge, serohemorrhagic, lead to serohemorrhagic exudate. This is a clinical signs and the clinical form of sporotrichosis. This picture shows environment mold form of sporotrichosis. Conidioform in flower at the tip of conidiophore. Some rose gardener disease. المولد فورم يشبه الروز. While tissue form yeast form, asteroid body or cigar shaped yeast. بالtissue form راح نشوف الاسترويد body. بالtissue form يختلف التيشيو فورم عن المولد فورم. بالtissue form asteroid body or cigar shaped yeast. Asteroid body or cigar shaped yeast. Asteroid body you can see as a star-like inclusion. Can be seen with multinucleated giant cell. Asteroid body star-like can be seen within multinucleated giant cell. This is asteroid body. هو مثل ما قلنا يسمونه روز جاردنر ديزيز. ممكن يكون solitary subcutaneous lesion at trauma site، وممكن يكون lymphocutaneous